what is this? Uterus. So uterus ends at the level of cervix, and from the cervix you will see the anterior vaginal fornix and the posterior vaginal fornix, right? And now behind these two structures, if we see now another structure called as the perineal body, which separates this urogenital structures from the angle. So now, as you know very well, behind this, I wanted to keep another structure here called as what? Rectum. So this is the rectum. This is the rectum. How it appears. So this is the lateral view of the female urinary bladder. Right? Now, what is the difference? In case of male urinary bladder, you are seeing the ductus deferens and the seminal vesicles. But in case of female urinary bladder, you are seeing the uterus, cervix, and also the upper part of the vagina. Right? These are the differences between the male urinary bladder and the female urinary bladder. Along with this, I also wanted to draw another diagram, that is the urinary bladder of infant. In case of infant, how the urinary bladder will be. So this is again same, that is the pubic symphysis. Now I am just going to draw. You can see some difference now. That is, now you can see that. So this is the empty urinary bladder in case of what? Infants. In case of infants. And I just wanted to keep this pelvic diaphragm here, add some pelvic diaphragm here, right? And now what is the difference? So you will understand the difference very easily. I am just writing these names. Let me write this name, label them. What is this one?
Pubic symphysis.
Pubic symphysis, right? Pubic symphysis, PHY, okay, no problem. This is what? Prostate gland. What is this one? Pelvic diaphragm. And this is what? Urethra. And this is what? Perineal body. And this is what? The rectum. And I wanted to write this one as what? Urinary bladder. And these are what? This is nothing but what? The ureter. And this is what? The ductus deferens. And this is seminal vesicle. And this is what? The denonvillous fascia. Okay, this is called as what? The denonvillous fascia. So these are all the structures which you are seeing. But now I just will write the same in female. That is nothing but what is this? Uterus. What is this? Cervix. And this is the vaginal organ, right? And rest of the things are same in case of male and female. And now I wanted to write here as this is nothing but what? The neck of the urinary bladder. Neck of the urinary bladder. You are seeing the neck of the urinary bladder. Here you are seeing the neck of the urinary bladder. See, now the difference between the infant urinary bladder and the adult urinary bladder is, if you look at these two structures, if I have to draw a line, see, the lower border of the pubic symphysis is now going and matching or reaching at the level of what? Neck of the urinary bladder in case of adult males, right? In case of adult females, the lower border of the pubic symphysis is also going and now getting like meeting at the neck of the urinary bladder. See, again I am telling you, repeatedly I am telling you, if you take the adult urinary bladder either in male or females, the neck of the adult urinary bladder is lying at the level of lower border of pubic symphysis. Am I correct? But now if you take the infant urinary bladder, the neck of the infant urinary bladder is lying at the level of upper border of the pubic symphysis. Upper border of the pubic symphysis. Is it clear? Right? Now let me just write some notes, that is about the urinary bladder. First of all, we will see about the volume of the urinary bladder. Coming to the volume of the urinary bladder, the average capacity of the urinary bladder will be between 120 ml to 320 ml. Okay, and now coming to the mean capacity. So the mean capacity of the urinary bladder is approximately around 220 ml. One is the average capacity and the mean capacity. But now these are all physiological. But the anatomical capacity, so which is nothing but how much urine you can store in that urinary bladder, how much it can stretch, how much the urinary bladder can extend up to, stretch up to. So in such a case, if I write it as the anatomical capacity. So if I write the anatomical capacity of the urinary bladder will be approximately between 1000 ml to 1200 ml in volume. Okay, it is 1200 ml in volume, right? This is the anatomical capacity of the urinary bladder. Now, coming to the next one, that is position. So now I am writing this as a note is because to make you understand basically. Now coming to the position of the urinary bladder, what is this orange colored one?
Pubic symphysis.
In my body, this is a pubic symphysis. Am I correct? So whatever is there below the pubic symphysis, it is what? Pelvic in nature. Am I correct? Am I correct? So now coming to the position of the urinary bladder, there is something tricky. That is the position depends upon two factors. Namely, one is based on the age and based on the volume. So based on the age, in case of adults, basically this urinary bladder is lying below the pubic symphysis, which means that it is lying within the pelvic cavity, right? Am I correct? Am I correct? So that's why I am writing here as in case of adults, the urinary bladder is pelvic. Am I correct? But in case of infants, you can clearly see that the neck of the urinary bladder is lying at the level of upper border of the pubic symphysis, which means that the whole of the urinary bladder is not in the pelvis, rather it is in the abdomen. Henceforth, now I will write it as not abdomen completely, I will simply write it as abdominopelvic. Am I correct? Because neck of the urinary bladder is still in the pelvic. So in case of adults, it is pelvic in nature, while in case of infants, it is abdominopelvic in nature. Right? Now, how can we say it is pelvic in nature? How can we say it is abdominopelvic in nature? You can clearly see that line, imaginary line, which I have drawn from the lower border of the pubic symphysis and also from the upper border of the pubic symphysis in case of infants. Right? That point also you can include here. Now coming to the next one called as the volume. In case of volume, the position of the urinary bladder when it is empty. When it is empty, this empty urinary bladder is lying where within the pelvis. So when the urinary bladder is empty, it is pelvic in nature. It is lying within the pelvis only. But when it is distended means when it is filled with urine. When it is distended, once it is distended, how the urinary bladder appears is like this. This is how the urinary bladder appears. So now I want to keep the pelvic diaphragm. Okay. Now I just want to keep this urinary pubic symphysis here. So now you can imagine what is the position of the urinary bladder when it is distended. When it is distended, it is abdominopelvic again. So this is the position of the urinary bladder based on the age and also based on the volume. Right? Clear? Now I wanted to write something that is the shape. So I will write the shape of the urinary bladder. So coming to the shape of the urinary bladder, when it is empty, when the urinary bladder is empty like this, it will have tetrahedral shape. When it is distended or filled with urine, It is when it is distended or filled with urine. It is what? How is that shape? How is it? How is this one? Once it is distended, how is it looking? Ovoid. So this means that the urinary bladder has got different shapes depending upon the presence or absence of urine in it. When it is empty without urine, it is tetrahedral in shape. But when it is once it is filled with urine, it is ovoid in shape, right? So these are all the like general features of this urinary bladder. Okay. Now coming to the external features of the urinary bladder. Coming to the external features of the urinary bladder, in order to make you understand about these external features, I will just try to draw one simple diagram. This is the urinary bladder. This is the posterior border, and now just now I said like like what the Rosen jack, right? That is they are in the boat, very busy loving each other. Yes. This is how the urinary bladder appears in an adult. So now just I am keeping these ureters like this. These are the two ureters, right? And if I have to add something else to this, I can add the pelvic diaphragm here. Okay, and also if you want me to keep something here, I can also add it to the male urinary bladder. I can also keep the prostate. Right. Now coming to the external features of the urinary bladder. Urinary bladder has got 4 borders and 4 surfaces. 4 borders and 4 surfaces. The first surface, that is the lower part of the anterior part of the boat, right? This lower part of the boat, this is called as what? The anterior border. Am I correct? Okay, anterior border. And here you can see a sharp edge of the boat called as what? The apex. Obviously, opposite to the apex will be what? The base. This is the base. Now you can see 1 and 2, clear 2 borders, right? These 2 borders are called as the lateral borders. Okay, this is one lateral border and this is the second lateral border. Now you can see between the lateral border and the anterior border, here you are seeing a surface on this side and also the opposite side. This surface is nothing but called as the inferior lateral surface. Okay, and now posterior to the posterior side, opposite to the apex, here also you see another border which is called as the posterior border. And of course, where Jack and Rose was standing, they are standing here, right? And this surface, whatever Rose and Jack were standing, this is called as the superior surface. Rose and Jack surface are the superior surface. This is called as the superior surface of the urinary bladder. But now we need to understand the posterior surface, where it is. Posterior surface, in order to show you the posterior surface, I am just drawing here another diagram. That is nothing but this is the superior view of the urinary bladder. This is the superior view of the urinary bladder, what I am showing you. In this superior view, this is the opening of the urethra. Where the urethra opens, this is the opening of the urethra, right? And now, I wanted to keep first of all a sharp anterior border like this. This is a sharp anterior border, okay? Sharp anterior border. And now you can see an yellow colored border I am just drawing. This border, whatever I am drawing, this is nothing but what? The lateral borders. Am I correct? Along the lateral sides. And now whatever you are seeing here in pink color, this is nothing but the base. This is the base of the urinary bladder, right? This is the base. So now just let me label these structures. I will write this as the lateral border, right? And I will write it as the apex. I will write this one as the base. Now this one I already told you that this is what? The sharp anterior border. And now I am just keeping the surfaces. These are two, this one, these are two inferior lateral surfaces. Now what is our target is to see the posterior surface. Now the posterior surface is the region between the urethral opening and the base, which is nothing but this is the area where you see the posterior surface of the urinary. Okay? So in this way, coming to the external features, you can write that in the external features you will write that the urinary bladder has got 4 borders, namely the anterior border, 2 lateral borders and posterior border. Clear? And 4 surfaces, namely 1 and 2. 2 inferior renal surfaces, 1 superior surface, and 1 posterior surface. That is 4 surfaces. Clear? So that is why we call it as tetrahedral. Tetra means what? 4. So that is the reason why we call it as a tetrahedral in shape. Right? Clear? Now we will come to the relations of this urinary bladder. Coming to the relations of urinary bladder, first of all, I wanted to show you something here. This is the pubic symphysis, from where you will be seeing the anterior abdominal wall, right? So already you know that the urinary bladder is covered on its superior surface by what? The peritoneum, the visceral layer of the peritoneum. And this from the apex of the urinary bladder, this peritoneum, it goes like this and condenses like this to form one ligament, which is called as the median umbilical ligament. So this is called as what? The median umbilical ligament. I will just write it as the median umbilical ligament. Median umbilical ligament, right? So now coming to the relations of the urinary bladder. I am not writing the external features, I am directly jumping into the relations. Coming to the relations. So now you know that there is an apex, there is a base, there are 4 borders and 4 surfaces. But coming to the relations, what we will describe is about the apex, relations of the apex, relations of the base, and also relations of the 4 surfaces also, right? So now let us see what are the relations. Coming to the apex. Apex of the urinary bladder. You can clearly see that the apex of the urinary bladder is related to one ligament here. What is this ligament called? Okay. And also the apex of the urinary bladder is related to this wall. What is this one? Anterior abdominal wall. So I will write it as the anterior abdominal wall. Okay. Now coming to the base, I will write it as here. I will write the base, relations of the base here. Further, to describe the relations of the base, already you are seeing 2 diagrams. One is for the male and also the female, right? So now let us describe the relations of the base in case of males. In case of males, the base of the urinary bladder is related to what? Can you tell me? Ductus differens, okay, right? Next. Seminal, vesicle, okay, and also third one is distinct one called as what? Renon, bilious fascia. Right? These are the 3 structures which are related to the base of the urinary bladder in case of males. But in case of females, it is totally different. Why it is totally different? Because in case of females, you are clearly seeing that this base is related to cervix and also the upper part of the vagina. So here I am writing as cervix and also upper part of the vagina. So these are the relations of the base in case of males and females. Clear? Now we have completed the apex, base. Now we will go to the next structure called as what? The superior surface, right? We will go to the superior surface. So I will just write it here as a superior surface. So the superior surface of the urinary bladder is again having different relations in case of male and females, because in case of males there is no uterus. So superiorly the urinary bladder in case of males is directly related to the what? What?
Pelvic diaphragm.
Am I correct? Even when we are dissecting also we have seen just above the urinary bladder what we have seen, all the small intestine. So in case of males, the superior surface of the urinary bladder is directly related to the roof of intestine. But in case of females, if you observe the diagram clearly, in case of females, the superior surface of the urinary bladder is related to uterus, and also then loop of small intestine, and anybody can say any other point, important point, without labeling. Can anybody say that important point? This area. Very good. That is the uterovesical pouch. So the third one will be the uterovesical pouch. These are the relations of the superior surface of the male urinary bladder and the female urinary bladder. Now coming to the inferolateral surface, right? So inferolaterally I will write it here. Now coming to the inferolateral surface, relations of the inferolateral surface, here you are seeing this is what the pubic symphysis. This is the inferolateral surface. So the inferolateral surface is basically related to the pubic symphysis, and also here there will be some fatty tissue will be there called as what, the retropubic fat, and this is called as a retropubic fat, and also this space which is present between the pubic symphysis and the inferolateral surface of the urinary bladder is called as, it is called with a separate name called as space of Ritzius. This is called as what? The space of Ritzius, and this fat whatever you are seeing is nothing but what, the retro means back, pubic fat. Okay, and also one interesting thing which will be explained to you during the prostate gland is, right, there is one ligament, nice ligament, which extends between the pubic symphysis towards the prostate gland. So there will be some ligaments here called as the puboprostatic ligaments in case of males, and I wanted to draw something here called as the pubovesical ligaments in case of females. So for a better understanding, I will label them like this here. These are now called as what? In case of male urinary bladder. So puboprostatic ligaments. And in case of females, it is directly going to the vesicle. So I will write it as the pubovesical ligaments. So now coming to the inferolateral surface, I am just starting to write. Please just observe the diagram. First point, what I am writing is like both in males and females, the same relations are there. But in case of only, the names will be changing that. In case of males, we will be writing the puboprostatic ligaments. In case of females, it will be what? Pubovesical. So now I will start writing. First of all, write it as the pubic symphysis which is related. Am I correct? Am I correct? First is the pubic symphysis, right? Behind the pubic symphysis, I will write it as what? Space of Ritzius. Am I correct? And within the space of Ritzius, what was there? What is there? Retropubic fat is there. And also now in case of males, there are two puboprostatic ligaments in case of males, right? And in case of females, there are what? Two pubovesical ligaments in case of females. So these are all the relations of the two inferolateral surfaces of the urinary bladder. Now you know the relations of the apex, base, superior surface, and also the two inferolateral surfaces. Coming to the posterior surface, right? So last one is the posterior surface. Coming to the relations of the posterior surface, again in case of males, the posterior surface of the urinary bladder, this is the posterior part, is basically related to this structure called as what? Rectum. So in case of males, it is related to the rectum. And also, you people know very well that there is a space between the rectum and the urinary bladder in case of males, which we used to call it as what? The rectovesical pouch. And in case of females, it is related to the rectum, and also what? And also what? The another pouch was there, important pouch. The rectouterine pouch, or you call it as the pouch of Douglas. These are all the relations of the urinary bladder. Clear? Apex, base, superior surface, inflated surfaces, and the posterior surface. Now we will go further into the interior of the urinary bladder. The interior of the urinary bladder is totally different from the exterior. The exterior of the stomach was totally different from the interior. Am I correct? The inner surface of the stomach was thrown into, like mucosal folds, which we call it as what? UA, right? So in the same way, if you take the urinary bladder, right? So if you take the interior of the urinary bladder, I'll just draw this one like this, small diagram. This is the urinary bladder. I'm just making it like this. Okay, now it leads into the urethra, and now this is the bulb of the urethra, and okay, downwards. Okay, fine. I just wanted to keep the prostate gland here for a better understanding. I'm just keeping the prostate gland here. This is the prostate gland in case of males, because I'm drawing the diagram of a male urinary bladder, right? And of course, in the upper part, you are seeing nice two tubes which are opening, right? What are they called? Ureters, right? So this is one ureter and this is the another ureter. Okay? Now if you see the interior of this urinary bladder, the interior of the urinary bladder is again thrown into mucosal folds like this. Thrown into mucosal folds. Okay? So it is also thrown into mucosal folds. But now, in the center of the urinary bladder, if you look at the center of the interior of the urinary bladder, because I've cut the urinary bladder, I'm showing you the interior of the urinary bladder. If you see the center of this urinary bladder, in the central part, you are seeing a nice area which is not having any mucosal folds at all. And it is what shape? It is what? Triangular in shape. You can see this is triangular in shape. So this central triangular region, which is devoid of mucosal folds, is called as the trigone of the bladder. It is called as what? The trigone of the bladder. And this, within this trigone of the bladder, you will clearly see during the dissection also, there is a nice eminence like this in the center. And this eminence is called as the uvula of the trigone. Uvula of the bladder, okay, or uvula of the trigone. So what is uvula? Uvula means something projection, just like a tongue. How the uvula is produced here in this trigone is, it is produced by the median lobe of the prostate gland. So as the median lobe of the prostate gland is pushing the urinary bladder upwards, within this trigone region, you will be seeing this one called as the uvula of the trigone or uvula of the urinary bladder. Right? Now, I wanted to connect this thing here. It is having nice opening here, and now you can see this is what? The extension of what? Ureters, right? This is the extension of ureters. You can clearly see the ureters are extending like this. So the question is that why is this trigone not having mucosal folds, first of all? And how is this trigone formed there? How is it formed? Because please remember that these ureters, whatever are there, they are having outer, which coat? Muscular coat? Longitudinal or circular? Outer, longitudinal or circular? Longitudinal, right? So what happens is as these ureters are coming towards the center, the longitudinal muscle coat of these both ureters will merge together like this at the upper level to form, the inter-ureteric ridge. So the longitudinal muscle coat of both the ureters, finally they merge at the center of the urinary bladder to form a ridge called as what? The inter-uretral or ureteric ridge. You can call it as inter-ureteric ridge, otherwise called as the Mercier's bar. That bar is called as the Mercier's bar. Now the same longitudinal coat is coming downwards on either side to form uretral ridge. Uretral ridge on the left. So in this way, the trigone of the bladder is formed. As the longitudinal muscle coat is firmly attached to the underlying mucosa, submucosa, that is the reason why here you will never see the mucosal folds. That is the exact reason why the mucosal folds are absent in the trigone of the bladder, right? So now let me just label these things. This is what? Ureter. And now I am just writing as what? This is what? Trigone of the bladder. And this is what? Uvula. And now I just wanted to keep this one as what? Urethra. Now I am just writing here, this is nothing but the interureteric ridge, and this is called as, or you can call it as what? The Mercius bar. This is called as the Mercius bar, and this is called as urethral ridge. Called as the urethral ridge. Okay, this is how the interior of the urinary bladder appears. Fine. So basically, the interurethral ridge is formed by the merging of the outer longitudinal coat of both the ureters. Okay. Now finally, we will go to the last part, that is the ligaments of the urinary bladder. Coming to the ligaments of the urinary bladder, the urinary bladder is having true ligaments and also false ligaments. There are true ligaments and also false ligaments. The problem is like there are 9 true ligaments for the urinary bladder. How many are there? 9. Oh, it's very tough to remember, right? 9 ligaments are there. Very tough. To show you the ligaments, I'll just draw like this. This is nothing but the sacrum. From the sacrum, I am just drawing the pelvis. In the anterior part of the pelvis, what will we see? The pubic symphysis, right? This is the pubic symphysis, let us see. And this is the pelvis, okay? I am just drawing the sacrum, okay? Here, this is the sacral region. Now, this is the exact location of this urinary bladder. So, now I am just going to show you those nine ligaments. I am going to show you 9 ligaments, right? What are those 9 ligaments? First ligament already you know very well. First ligament you know very well. What is that first ligament? Median umbilical ligament, right? Already you know 4 ligaments. In case of males they are called with some name. In case of females they are called with other name. Puboprostatic. Now the thing is like there are in case of males there are a lateral puboprostatic ligament and medial puboprostatic ligament. Suppose if you think that it is a female, there are lateral pubovesical ligament, medial pubovesical ligament. Totally how many ligaments are there? 4. So I will here write it as puboprostatic or pubovesical. How many are there? 2 plus 2, 4. Am I correct? So totally how many ligaments came? 5. Now you can see there are 2 more ligaments which are connecting the urinary bladder to the posterior of the pelvic wall. There are 2 more ligaments which are connecting the urinary bladder to the posterior pelvic wall, which are now called as, these are called as the posterior ligaments. Simply they are called as the posterior ligaments. So how many posterior ligaments are there? You can write it as posterior 2 ligaments. Now on the lateral side also urinary bladder needs some support. So there are again 2 more ligaments which are connecting the urinary bladder to the lateral pelvic wall. Lateral pelvic wall. These are nothing but called as what? The lateral ligaments. So how many lateral ligaments are there? So totally how many came? Finished. Now along with this, there are also false ligaments. So false ligaments are not so important, but however I am writing it. So what are the false ligaments of the urinary bladder? That is important. So what are these false ligaments is like, you are seeing a median umbilical ligament, right? Over this median umbilical ligament, the visceral layer of the peritoneum is also coming. In the central part, it is condensed to the pelvic fascia, to become the median umbilical ligament, which is a true ligament. But on either side of this true ligament, what is happening is like this visceral layer of the peritoneum is folding like this. As a result, in the center, just above this, like median umbilical ligament, one layer of peritoneum is lying like this, which is now called as the median umbilical fold of peritoneum, right? And also on either side of this one, the peritoneum is folding like this, just like a wings, right? So those two are nothing but called as the lateral umbilical folds. Along with this, you will also be seeing another fold of peritoneum called as the sacrogenital fold. These are all the false ligaments of the urinary bladder. Now the problem is with the blood supply. Coming to the blood supply of the urinary bladder, it is little tough to remember. However, I am writing the blood supply here. The blood supply of the urinary bladder comes through various arteries. So especially the arteries, it is difficult. The blood supply of the urinary bladder comes through, one is the superior vesical artery in case of males and females, inferior vesical artery in case of males and females, obturator artery in case of males and females. But now in case of females, additionally the urinary bladder receives blood supply through uterine artery and also the vaginal artery. But in case of males, instead of vaginal artery, the males will receive an additional blood supply through the rectal artery. So these are all the arteries which supplies the urinary bladder. Of course, you know that the urinary bladder is lying at the level of the internal iliac vein. So all the venous drainage goes to where? Internal iliac vein. Now the last final point, which is very, very important to remember for MCQs, is that is the most important point called as the what? Nerve supply. Please remember that urinary bladder is voluntary or involuntary? Both, right? So as a result it is receiving nerve supply from parasympathetic system, okay? Parasympathetic nerve supply and also sympathetic nerve supply. The parasympathetic nerve supply from the urinary bladder comes from it is at the level of sacrum. So S2, S3 and S4, while the sympathetic nerve supply comes through T11 to spinal cord. This is all about the urinary bladder, which is complicated question for the examination. Okay? Along with this, if they ask you in the examination, they will ask you about the applied aspects and also the histology. So now things are turning little tough, right? Things will be worst when you come to head and neck, but to brain.